Imagine being able to detect cancer before symptoms appear, pinpoint where it started, and even guide treatment based on molecular signals floating in the blood. This is no longer a science fiction. It's the promise of epigenomic liquid biopsy. Today, our panelists will explore how close we are to making this a reality. In this session, from code to control, the transformative role of epigenomics in precision oncology, organized by Voice of Healthcare and supported by Zydus Healthcare and Garland Health. Join me in welcoming Dr. Jyoti Wadhwa, Lead Medical Oncology and Precision Oncology, Apollo Athenaa Women's Cancer Center, Delhi. Welcome, Dr. Jyoti.
Thank you, Dr. Manisha. Thank you.
Dr. Vaishnavi Joshi, Consultant Medical Oncology and Haemato-Oncology, Aster CMI, Bangalore. Welcome, Dr. Vaishnavi.
Thank you, Dr. Manisha.
Dr. Amit Rauthan, HOD and Consultant, Medical Oncology, Immunotherapy and Precision Medicine, Manipal Hospital, Bangalore. Welcome, Dr. Amit.
Hi, good evening.
So I'm Dr. Manisha Khurana and I am your host for the day. So let's first understand from Dr. Amit that how do you define epigenomics and in what ways does it fundamentally differ from genomics or genetics?
Thank you, Dr. Manisha. So we've always heard about genomics, which is actually the study of the study of the genes which we are talking about, the DNA sequence. Now we have come to an understanding where it can happen that the DNA sequence is not affected, but the way the DNA genes are being regulated or being expressed is being changed. And that understanding of how this expression of gene changes, how it matters, how it is regulated, this is called epigenomics. So we always say the gene is normal, the DNA sequence is not altered, but the way the sequence of the DNA is being expressed, that understanding is called epigenomics. Now we have genomic sequencing and testing has been there for quite a long time. So we knew this whole concept of the genomic understanding of genomic mutations. But now we are understanding that regulation is equally important and regulation can be sometimes more important. The genes get overexpressed or underexpressed. And this understanding is all which is understanding of epigenomics.
So maybe you're trying to say that it helps us in reading the DNA code. Is that so, Dr. Amit?
Yes. In some ways, how the code is read, which part of the code is read more proficiently, more effectively, which is not being read. So that becomes more important. The code is the same.
So Dr. Jyoti, why is this regulation of gene expression through epigenomic mechanisms so critical to normal cellular function?
So as Dr. Amit said, it goes beyond just the presence of genes. Their expression, the way they are expressed, which genes are to be turned on, which are to be silenced. That is what is meant by epigenomics. So we have learned over the years that these epigenomic mechanisms are extremely critical to cell function. So imagine, there's an orchestra and we have musicians and consider musicians to be like genes. You do need a conductor of the orchestra, and that's what is epigenomics. So without this conductor, the music would be like noise. And similarly, if the wrong genes get turned on, or the important ones or good ones get silenced, there would be this noise or cacophony or disease, right? So that is exactly what the epigenomics does. So the cells which are, say, preventing uncontrolled or rapid cell growth, if they get silenced, or the genes which push the cell to divide get turned on, and there's this imbalance, then this is what could lead to cancer. So just the presence of genes is not enough. It's their expression which is getting controlled by the epigenomic mechanism, which here, assumes equal or greater importance. So epigenomics is actually controlling all those mechanisms which control the or regulate the turning on off of different genes. And that's exactly how the different tissues and therefore different organs are able to carry out their different functions through the activation or inactivation of the different genes through epigenetic mechanisms. And that's why the epigenomics is extremely critical for normal cell function.
Rightly said. So we have certain uh, tumor suppression, we have oncodrivers. So these are the epigenomic part which is regulating these, and whenever this orchestra is affected, it turns into cancer. So, Dr. Amit, what role do environment or lifestyle factors such as diet, smoking, or chronic stress play in shaping the human epigenome? And how does that link to cancer risk?
So, uh, one, it's a very fascinating field of epigenomics where we are understanding that uh, this is something that you can acquire depending on the change of the environment around you. So we started getting, you always hear about, uh, I, I, it was some change in exercise and some change in diet and some change in environment which caused the cancer to grow or the cancer to shrink, and there are changes which happen. So what we understand is epigenomics is something that can be changed due to the environmental changes which happen, and these are kind of markers which are controlling. So it could be, if you did a pattern of healthy diet, if you did a pattern of healthy exercise, there may be changes in the signature due to which the bad genes get turned off and the good genes get overexpressed and they become active. And this control is something which is very dynamic. And this is very interesting in epigenomics. What this is meaning is it is not stamped there in the genome that you have this abnormality and this will happen. It means that any change in the environment, any change in factors can push up or down the genes, and they can cause expression of cancer to happen, or they can cause the tumor suppressor genes to get overactive and you can suppress the cancer growth. So this whole learning of epigenomics, that it is a dynamic process, is very fascinating for us in cancer. So this way we think why would someone, we would say, uh, sometimes you say if someone is having um, a diet which pattern changed and they say, oh, my, with this my cancer has changed, my cancer expression has, with this healthy diet my cancer has kind of regressed. We used to say, why would it happen? It's not that a real diet can really change your cancer cell. It can't kill cancer cells. Or if I did exercise, my cancer cells suddenly regressed. But now we understand that this can be explained by epigenomics. When you change your diet, when you change your exercise pattern, when you do environmental factors which changes our gene expression, and they kind of can cause the balance to tip up. They can cause the good genes to go up, and that can cause the tumor to suppress off. And this is a very fascinating field, understanding the dynamic nature of these genes which are overexpressed or underexpressed depending on what the environmental features are.
Right. So I think bad habits, should not be there, especially the smoking part. We can always see, when it is affecting the epigenome so much. So, Dr. Vaishnavi, in what ways do cancer cells exploit or reprogram the epigenome to drive tumor initiation, progress, and even treatment resistance?
So we have in the past few decades, we have understood that cancer cells are, smarter than we think. We actually understood a few decades ago. So our body, like how we fight infections, it has a system of fighting tumors also. So we have tumor suppressor genes and we have oncodrivers, and our system or our genetics or the chemical mediators, they drive the system actually to prevent cancer growth proliferation. But what a cancer cell does is, in the last few decades of research has shown that it manipulates this epigenomic system. It actually hacks into this system, and it can suppress the natural breaks which are there, to silence suppressor gene to activate oncodrivers. And not only this, which leads to cancer growth, development, and metastasis, it can also make themselves resistant to cancer therapies. So this is how the cancer cells, they hack into the system of epigenomics, which we have understood in the last few years, and manipulate the system, and not only proliferate, also become resistant to cancer therapies. So this is what the understanding of epigenomics has led us to believe that the cancer is a master manipulator.
That now tells us that why certain targeted therapies, fail, why some are able to cure it, others are not able to cure it. So my next question is regarding this only to Dr. Jyoti, that how does epigenomic profiling help us understand why patients with the same genetic alterations often respond differently to these targeted therapies?
So again, the reason is, as we have been discussing, the epigenetic mechanisms, because besides that genetic alteration, there are other mechanisms which are playing a role in silencing something or overactivating something or leading to overexpression of another gene. So it's basically the interplay of all these mechanisms which will ultimately decide as to what the outcome would be or response to a particular treatment would be. So it's not just one genetic alteration, its presence or absence. It's the other things also, there may be a report. So we are practicing in the era of precision oncology, and for our cancer patients, we do resort to the comprehensive genomic profiling and base our decision basis the presence or absence of certain alterations in the tumor. So these, just the alterations are not enough. There are other things also which will affect the response to a given agent or a given targeted therapy. And similarly, there are, other changes also besides and beyond the mutations, which would then determine the response to a particular targeted therapy. So that's why we have moved on to doing comprehensive genomic profiling, wherein just showing presence or absence of one alteration is not enough. There are so many instances when we do take into consideration the presence of multiple alterations in choosing a particular drug. We also can predict whether how successful that given targeted therapy would be. So all that information is very important, right?
Right, right. So definitely, man, it's an era of precision oncology, and I believe that epigenomics is playing a role. Dr. Amit, can epigenomic help identify where a cancer started, especially when it has already spread?
Yeah, so we are we have just started to kind of understand the whole testing of cancers using epigenetics. So what we have understood is we can have epigenomics scars or epigenomic markers for different types of cancers, and these like there can be a different marker for a colon cancer, a different epigenomic signature for a breast cancer, or a different epigenetic signature for a lung cancer. And what we are understanding is these marks or these scars epigenetic can develop before the cancer develops in the body. And now, with the level of testing which is coming in, with the advances of testing coming in, there are ways by which you can test your blood and look for these epigenetic scars. And if you pick up a epigenetic signature of a breast cancer, it is possible you may catch the breast cancer much earlier than when the cancer develops and picked up in a late stage. And this is a very, very new and novel way of diagnosing early stage cancers. So we already have some tests like these available for colon cancer. We had tests on the stool for colon cancer, where you could send the stool test and get the epigenetic signature of colon cancer cells before the colon cancer developed. And now we also have tests for blood cancer, where you can you for colon, you send the blood and you can pick up some epigenetic signature which says this is possibly a scar pointing to colon cancer. So that's where this is a very, very interesting field. And recently, there are new tests which have come in which are looking at various cancers in one blood test just by looking at epigenetic signature and trying to say, can we catch multiple cancers early before you develop symptoms or before you develop any signs of cancer? Now, this is really very cutting edge. This is something that even we as oncologists don't know what to do with. Once you kind of get such a test and such a result, you really don't know how to answer your patients, because this is such an evolving field. But whatever said and done, the science of epigenomics, the way it is being understood, the way it is being put into testing platforms, is something that we will definitely have to adapt to as oncologists also. Once these tests become easily available, we will have to see how they will get adapted into the community for patients or for normal people. Are they going to get into screening because you're picking up these signatures in normal people? But the whole field is very, very interesting, and it's a very, very fast evolving field.
Rightly said, sir. It's very fascinating that each cancer has got a different signature, and if we are able to catch something very early, even if it is not, developed in a particular organ, or even if it is metastasized or there in the distant organ, we can catch up from where it started. It's something fascinating, and as an oncologist rightly said that it's much more exciting for you as for any other doctor. Dr. Jyoti, are there any cancer treatments that directly target epigenomics?
Yes, the short answer is yes. So I'll give you some examples. Say, for many years now, we have been using a drug called azacitidine for acute myeloid leukemia, which is basically a type of blood cancer. And it's a demethylating agent which is being used in these acute myeloid leukemia cases. And this basically targets the epigenomic changes. Now, for coming to that's for blood cancer, but in various solid tumors also, just to share with you that say yesterday only, I saw a lady with the ovarian cancer, and in her report, the comprehensive genomic profiling, we found BRCA1 promoter methylation. So that itself, even though she tested negative for BRCA mutation, now this epigenetic promoter methylation makes her a candidate for a class of drugs, what we call PARP inhibitors. So even though the mutation was absent, but just this epigenetic promoter methylation presence has opened up a new type of treatment for her. So this is very relevant. And similarly, say for a type of brain tumor, say called glioblastoma and similar gliomas, we look for MGMT promoter methylation. And if we can find that if somebody has that the tumor has MGMT promoter methylation, then we can predict sensitivity to drugs like what we call alkylating agents such as temozolomide. So such tumors would then be more sensitive to action of drugs like temozolomide. Just to give you one more example, um, there's a lot of noise there. Yeah. So MLH1 promoter methylation. So that could become a prognostic indicator in, say, patients with endometrial cancer, and it could predict benefit from immune checkpoint inhibitors. So similarly, there are various examples available to us now based on these epigenetic changes, wherein we can choose a particular set of treatments. We can predict response to treatment and therefore choose our treatment more wisely. So I think we are already using it in our practice as medical oncologists, and the results are much better than just using blind treatments. As I said earlier also, this is what we mean by precision medicine, and this is what is precision oncology. And epigenetic understanding of epigenomics plays a huge role in this decision making.
Right. And Dr. Vaishnavi, how are these epigenomic based tests, liquid biopsy, different from the genetic ones? Unmute yourself.
Sorry. Yeah, so we used to base our decisions, oncology treatment decisions were based on subtype of a cancer, where it's arising from, or what is the pathology, whether it's an adenocarcinoma, squamous cell carcinoma. Next step was the treatment was driven by the tumor biopsies with mutations, that is finding out targets. So the biopsy further mutation testing was the next step, and then came the liquid biopsies, where we could see or check for these mutations, which are essentially typos in the DNA, and then targeted therapies could be offered to these patients, which has actually revolutionized the way we treat advanced cancer. So going a step further from this is doing liquid biopsies to find out epigenomic changes. Even that has become a reality right now. So epigenomic changes, or these are certain fingerprints which are left by the cancer cells on the cancer cells, which can be detected and then can be used for making our treatments more precise for first. Second, so these signatures which are found by liquid biopsies, which are definitely now it's become a reality, finding out epigenomic changes by liquid biopsies. So not only helps in planning treatment, also, as sir was mentioning, in early detection. So finding these scars or fingerprints or epigenomic changes, not only we can say there is cancer, also can find out where is this arising from, because there are, it can also detect or trace which organ or which type of cancer it is arising from. So this has revolutionized the way we look at cancer. But early detection again is a field which has challenges, with a lot of ethical challenges and moral challenges. We need to have discussions, and then how to take this exciting field forward. So liquid biopsy with epigenomics, I think it's a reality. It's going to change the way we look at or treat cancer patients.
Have been telling us you have been telling us that it can pick up, the organ from where these circulating DNAs, are arising. So could epigenomics make cancer detection possible even before the symptoms appear? Yeah.
Who is it for?
For you, sir.
Oh, okay. Okay.
No.
Sorry, I didn't hear that. Okay.
So I can repeat. Have you got the question?
Yeah. Okay. So I think that's one of the most exciting part of epigenomics, and I think if that happens, that will really change the way we look at picking up cancer. So for us, it's always we detect cancer once you have symptoms, and most patients would pick up through symptoms, and many patients, when you pick up through symptoms, are in advanced stages, and we know cure of advanced stage is very poor. So in cancer, you keep talking of early detection, and we talked about early detection for years with screening, but in reality we have screening only for 4 cancers. We can only screen for breast cancer, cervical cancer, colon cancer, and maybe some head and neck cancers. We really don't have great screening tools for many cancers, and we don't pick up many cancers very early. So there's always that excitement that if I have a blood test which I can do and pick up a cancer early and say that this patient has a chance of developing this cancer, and this is what we need to look for or chase for. That would be very, very exciting. And we already have these kind of tests available. There have been recent blood tests uh, which are called multi-cancer early detection tests, which actually look at blood, and if you do the blood test, they look at epigenetic signatures and then say that there is a possibility of developing this cancer because this is the epigenetic signature from colon cancer, suppose. Now, I think it does sound very exciting, because if we catch it early, our chance of cure is going to be very good. But we need to be aware, are we there yet for clinical utility? Because there are a lot of questions which will come up. And the whole thought is, if we pick it up early, how are we going to treat it if it's not developed yet? How are we going to, is treatment going to make a change? Is it going to cure early? So there are a lot of questions which you don't have answers to. Also, we don't know that if you pick up an epigenomic signature early, when does the cancer later develop? When does it develop with symptoms? We really are very preliminary in this science. It's just that we have definitely exciting tools in our hand now. They have to be put in through proper research channels where you look at patients properly, evaluate. Once you pick up, what do you do with them? How are you going to treat them? When do they develop cancer? And then improve their survival. How to cure them? Or I would be very tempted to say, we know epigenetic signatures are not permanent scars. They are dynamic. So I would say, is there a way possible in future that you pick up a scar, a signature saying that you can develop colon cancer, and other ways by which you can reverse the signature and not develop the cancer? These are so many exciting thoughts which come to our mind just because the field is so different from what we have till now understood about cancer. We were so obsessed with just the genetic abnormality or the genomic mutations. For years, we kept saying genomic mutations are the way we develop cancers, they progress. But now we are understanding so much more by doing epigenomics. So that's why I think we do have a very exciting time ahead. But yes, if you ask me, are we ready for prime time to do it in clinical use? No, not yet. We still need to understand the science much more and the utility much more better.
Right. And Dr. Vaishnavi, since we have been talking about that these are lifestyle mediated, signatures, the epigenomic signatures, do you think that these epigenomic changes are reversible, unlike the genetic mutations?
So I think we've been discussing that, the genetic mutations are like permanent changes, and epigenetic changes are modifiable. So I think, as Sir was mentioning, we have reached a place in clinical medicine, at least, where we can modify epigenetic changes. So we have seen that with DNA methylating agents, histone deacylators, HDAC, and then DNMTs. So there are many therapies or medicines available which modify the epigenetic changes and give a therapeutic effect. Are we there to reverse whatever has happened? So that is something which is very exciting, which is stuff for science fiction, which was we used to think it's science fiction stuff, but then it's becoming a reality. We are seeing things like epigenetic editing, which is happening, which is being utilized not only in cancer, it's also within, it is being studied in vitro fertilization. It is being studied in certain genetic therapies for metabolic disorders. And also, if patient has a susceptibility for cancer, can we reverse this change? I think right now this is the exciting field which is going on. So we have, by caution, I would say we are there. Epigenetic modification, reversing epigenetic changes, I think we will reach there, but have to wait and watch.
Although it's dynamic, but whether we can reverse or not, that is something which we have to look into. So, Dr. Jyoti, what does the future of cancer care look like with epigenetics?
I would say that future of cancer care looks bright with so many advances taking place almost on daily basis. So much of research happening, even in epigenomics. So since we are talking about epigenomics, so as Dr. Amit also pointed out, we are already using it across the continuum of cancer care, be it screening, where its role is increasingly being identified to screen the asymptomatic individuals, right? To minimal residual disease detection in patients who have been treated, and now we are following them up, and we have to take a decision as to when to, come in again with some treatments. So that's minimal residual disease detection, and also to determine treatment of various advanced stages of cancers, various cancers. So herein we are already using epigenomics. So the other thing that I want to emphasize is that currently we sequence a tumor, say, once, and we base our treatment decisions on that snapshot information, I would say. But the future seems more bright as well as dynamic because of the knowledge that we get from the epigenetic studies, because we can then continuously monitor the cancers, their status, and the response to treatment. We can do these based on the liquid biopsy or blood test, the epigenomic blood test, and therefore we can see as to how the tumor is evolving, and when is it developing the resistance mechanisms. We can identify the exact resistance mechanism also, and therefore can adapt the treatment in real time. So the process, then the decision making process, would become very dynamic. And it would be something like, if we want to correlate, it would be like GPS navigation. So instead of following a one fixed map, we'll have a GPS navigation system to give us live traffic updates, so as to say, giving us information about the obstacles herein, the resistance mechanisms of cancers, and we can then reroute or adapt the treatment, modify the anti-cancer treatment accordingly, and therefore end up getting best possible results with our treatments, with our timely interventions. So that's how I see the cancer care moving forward in future with epigenomics.
Going to meet it, I would like to ask each one of you that how might you think the future looks like to you when we integrate genomics, epigenomics, proteomics? How do you see future? How will we diagnose the cancer? How will we treat the cancer? Whether we need certain more guidelines, when this multiomic approach is being followed by you people. So let's start with Dr. Amit. What's your thoughts, sir?
Yeah, I think in many ways testing is always leading the way. The science, the way the technology is, it is leading the way very fast. Unfortunately, our data and our experiences are lagging behind quite tremendously. That's the whole thing is about when technology changes so fast, your data also has to catch up, the experience has to catch up, and that's what's still taking time, and it will definitely catch up the way it's going forward. But definitely, as just mentioned by Dr. Jyoti, it's so important for us to know the dynamic information of cancer, be it the genomic information, be it the epigenomic information, be it maybe transcriptomics, the whole proteomics. Everything is becoming very important. We know we have gone from the era of just saying kill cancer with chemotherapy and that will cure patients. We know that's not going to happen. It's all about precision oncology. Find out what targets are there, try and look at that way, try and overcome target resistant mechanisms, look at combining mechanisms, and look at trying to overcome cancer in different ways together. That's the whole way why precision oncology is moving forward. We also are understanding we know immunotherapy has such an important part in cancer care now. We have moved to immuno in every line of cancer care, but we have also understood that immunotherapy by itself also gets resistant many a times. And that's where the whole integration of immunotherapy with epigenomics is being studied. And that's another very fascinating field where you're trying to kind of say, why are those silencings happening where the immune response doesn't come up the way you want it to? And now there are more and more clinical trials of integrating immunotherapy and epigenomic tools to try and say, can we make a robust immune response of the body against cancer, which can last a long time? And of course, one cannot really ignore the fact of early detection always matters, and that's also a very, very exciting place of epigenomics in future.
Dr. Vaishnavi, how do you see integrating multiomic, approach, whether it's diagnosing or treating the cancer patient?
So I think 30 years ago, if somebody told us that a lung cancer stage 4 patient would live for 5 to 10 years, none of us would believe it. So we are seeing that as a reality now. And then nowadays, we actually, patients believe in destiny, that they got this cancer and that have to deal with it. We may reach a stage where by epigenomics, where we are able to modify our risks and also modify our susceptibilities. I think that will be an exciting field. And omics, as far as genomics, how we have integrated into cancer therapies, and then we have seen the results from cell to bedside. We have seen the results happening. I think this will be the next big game changer. Epigenomics, changing the way we look at cancer therapies. I think there are many more things coming up in epigenomics, and we'll be able to treat more cancers which we were thinking are lost cases. There is hope at the end of the tunnel. Thank you.
And Dr. Jyoti, your takes. Do you think that we need some guidelines as well? How to integrate this multi-omic approach into treatment as well as diagnosis?
Yeah, definitely. So, we have always known that care of cancer patients involves a teamwork. And I can see the team only getting bigger and better with all these passing years. So it's no longer just a team of medical oncologists, surgical oncologists, and radiation oncologists. So this team got bigger earlier with the inclusion of our nurses, the nutritionists, the counselors, the pathologists, radiologists, intervention radiologists. And then more recently, we have seen the incorporation of genomics. So the molecular pathologists or molecular biologists or molecular oncologists got integrated into this team in a big manner. And I can only see them, expanding. Their role is getting bigger and bigger day by day. And we definitely need interactions on almost daily basis to make our decisions. And that's why we have now molecular tumor boards, because we have learned that all these inputs of genomics, epigenomics, and proteomics and transcriptomics, all these inputs are so relevant to our decision making and to the outcome of these patients. So if we have to, offer the right treatment at the right time to the right patient, or the best treatment, then we have to, be all inclusive, interact more often, more, regularly. And obviously the guidelines are also evolving as time is passing. And we have seen ourselves also the international guidelines taking into consideration this information also, and taking this information, the genomics, epigenomics, into the decision making. So obviously, yes, this will become more and more important and relevant in not only cancer treatment, but also cancer screening, early detection, the minimal residual disease detection that I was just referring to also. So it's going to be a continuum of care with all of us interacting together more often for all the patients.
And we have been talking about multi-cancer early detection tests. And since you all are experienced oncologists, again, I would like to ask each one of you that for people listening at home, those who are healthy and they don't have cancer, what would be one key takeaway from the session you would like to give them? Dr.
So, for normal healthy people, I think a healthy lifestyle, that's probably the most important factor. I don't think we should be scared about cancer. There's no point being scared about it and living in fear. Lead a very healthy lifestyle. That's very important. Healthy diet, exercise, avoid tobacco, avoid smoking. I used to say this as a routine thing that we tell everyone. But sometimes we used to say it saying that, oh, that's because it affects cancer cells in different ways. It definitely affects cancer cells in different ways. But what we are also understanding is, in many ways, it is acting via the epigenetic phenomena. All these factors which we talk about, a healthy diet, a healthy lifestyle, all of these, exercising, are affecting the epigenome. That's how they are causing expression of genes to change. So they can cause the tumor suppressor genes to remain active, and they can get the oncogenes to be suppressed, and that way cancer can be prevented in healthy people. And that's the reason why we say try to lead a very healthy lifestyle, avoiding all those carcinogens which you know about, like smoking and tobacco, and that's the best way to live.
Dr. Jyoti?
Yeah, so I would agree. You asked about these multi-cancer early detection tests. I think that's your question. So
Yes.
I would say that those tests are still investigational. Um, some of them, a few of them, have been used in various studies as part of studies, and one or two have been commercialized as well. But one has to really understand, as we have been saying, it's very important to be counseled as to the pros and cons of undertaking a test, because the matter doesn't end there. Doing a test is very easy, but what would you do, if it comes positive? You have to be really mentally and otherwise prepared for that also, for the result of the test. So it can't be offered blindly, any of these MSEDs to each and anyone. So one has to be very careful, and one has to take into consideration various uh, details as per that individual, and then counsel. There has to be a pre-test counseling, which is very, very important. Don't just offer it as a blanket test to anyone. They are not yet ready for that type of testing.
Right. And I think Dr. Amit has rightly said that epigenomic signatures are very important, especially for the organ from where cancer cells are circulating, and as well, this is a dynamic process, and lifestyle modifications can definitely help. And this also helps us in minimal residual disease, as has been told by Dr. Jyoti, that we can pick up the cancer early even if it's not recurred. So I think these fields are exciting. The way you're told that dynamics are changing and how you approach a patient, either for the early screening or for diagnosis or for treating, and even getting to know that who would respond and who would not respond to the targeted therapy. Things are changing. I think the treatment is also evolving, and the way we pick up the cancer and the way we treat the cancer is also changing day by day. So it's an exciting field and exciting conversation, and so good to have you all on this important panel discussion.
Thank you, Dr. Manisha.
Thank you.
Thank you very much.